All right, Delano, thank you. Now on Bounds, February is National Children's Dental Health Month, and so we want to show you some ways to keep your child's oral health in the best condition. I want to welcome Dr. Chase Prettyman of Prettyman Orthodontics. Nice to have you here.
Thank you. It's wonderful to be here.
So you say good oral health care starts with your child's baby teeth.
Absolutely, it does. You know, February is National Children's Dental Health Month, and it's a really critical time to focus on and emphasize the importance of your teeth and your oral health. We're learning more and more that oral health truly is a window to your overall health. So it has been correlated with cardiovascular disease, diabetes, adverse pregnancy outcomes. So it's really important to focus on that and start at a young age, because your oral habits, they truly start and are established at a very, very young age. So it's important for parents to get involved and really help them establish a good dental routine as a child.
I mean, how do parents do that? At what point do you start, you know, the brushing the teeth habit?
So on average, a child gets their first teeth around the age of 6 months. So you really want to start then. You want to do brushing at least twice a day. Morning and night is the most important. The biggest thing of the parent getting them involved really with the dentist also is you want to have them by the dentist at the age of 1.
Okay.
That might sound early, but it is extremely important, because you want that first appointment to be correlated with a very positive experience. So you want it an easy visit. You don't want to wait till they're having dental problems and then take them and have a traumatic or pain,
sort of thing.
And then that's how they develop a dental phobia and have a lot of pain or discomfort. So it's important at a young age.
So what good habits should kids start early? And of course, this has to be reinforced by parents.
Well, absolutely. You know, it starts there with teaching them, but you know, children, one of the most important things in addition to brushing, flossing and all of that is also with dietary habits. The healthy snacks is critical. We were all kids, we all loved to snack. We still may love to snack. There's nothing wrong with that. But sticking with fresh fruits, vegetables, cheeses, those are great things. You want to limit sugary drinks, juices. Sometimes people think orange juice and all this are very good, but it's acidic, so that's not really good for your teeth to constantly do. You know, tap water actually is a really important thing as well. A lot of people are focused on bottled water more, but it doesn't have the optimal level of fluoride all the time. It's not as regulated as much. That's actually the slogan of this month was choose tap water for a sparkling smile. So it's something to focus on that as your primary drinking water source.
So tap water is A-OK, folks. Let's see. What are some of the main issues you see when it comes to your youngest patients?
Well, you know, the age, like we kind of focused on, is when they're coming in at a young age and they may not have had that direction or may not have had those early appointments, so they're kind of behind already. You come in and you may have cavities from the start, or you may just be associated and have to have some more not as comfortable or painful work, and that's the biggest thing. You can see that where those habits have been established and they've established cavities, even if it's baby teeth, they're still important to develop that.
I want to go back, because you were saying you should start brushing the teeth when they get their first tooth, which can be as young as 6 months.
Yes.
Are you using a toothbrush, or are you using your finger? Like, how does that work?
So before teeth, even at birth, you want to even use a washcloth to wipe the gums. Once the teeth come in, do use a very soft, smaller, bristled, obviously, toothbrush.
Okay.
You can start to use fluoride toothpaste even at that stage. You want to use a very light smear on the toothpaste. You don't obviously want to use a lot, but up to the age of about 3, and then from 3 to 6, a pea-size amount. But it's very important. Even a lot of people wonder, how long should I help my kids brushing their teeth? Actually, up until the age of about 7 or 8, you still want to assist them. They don't have the manual dexterity yet to get all the back teeth. So even up to that age, you still want to help them brushing.
And I imagine those back teeth is where you can see those cavities.
Yes, absolutely. That's where a lot of times, you know, we all miss, because you don't get all the way to the back and you're focused more on the aesthetics of the front teeth and keeping them white and clean, but the back teeth are where you can have a lot of problems.
Just as important.
Sure.
And precautions for kids who play sports.
So you always want to focus on protecting the teeth with sports. So always we recommend mouth guards. You can get all kind of over-the-counter stock mouth guards that are important. Once they're a little older and have established more of their full dentition and teeth, you can even have custom mouth guards made that are even more protective.
Okay. All right. Anything else you wanted to add, Dr. Prettyman?
I mean, one of the brief main things, too, is to focus on, for me, from an orthodontic standpoint, a lot of times you may even want a child to come in at the age of around 7 initially, which may be early. They may not need any braces or any problems at that time, but again, you're starting to get your first permanent teeth at that age, so it's good to focus and make sure if there is a problem that needs addressed that it is.
Okay, you're getting there early. You brought some props, toothpaste, and toothbrushes that'll be good for kids, for our young folks.
Absolutely. Very, very important.
And so the softer bristles, even as they get older?
Exactly. Most toothbrushes nowadays you'll see are soft bristled toothbrushes or extra soft. Older ones a long time ago were more hard bristled, and that can have periodontal or gum effects if you're brushing too aggressively or too severe with that. So you always do want to stick, yes, children or us as adults with soft bristled brushes.
All right. There are 4 locations for Prettyman Orthodontics. They're in the University area, South Park, Gastonia, and Monroe. For more information, you can log on to WBTV.com. Look at the Web Extra section right there on the homepage. Dr. Chase Prettyman, thank you so much for being here. We certainly appreciate it, and it's always good to start the conversation early.
Absolutely.
When it comes to your child's dental health.
Thank you so much.
You're welcome. Delano?
Time now.